The complications of stem cell transplantation include infections, gastrointestinal reactions, hemorrhagic cystitis, pulmonary fibrosis, thrombocytopenia, and anemia, or GVHD. The infections include bacterial infection, fungal infection, cytomegalovirus infection, varicella zoster virus infection, and pneumocystosis. GVHD, graft versus host disease, that is GVHD, means the reaction of donor T cells against host T cells. Both the peripheral blood stem cell transplantation and BMT could induce GVHD. In sometimes, the blood transfusion could also induce GVHD. The essential factors necessary for GVHD include immunologically competent donor graft, histoincompatibility between donor and host, and immunologically incompetent host. The risk factors for GVHD include MHC disparity, the age of the patient, the sex mismatch, CMV serology, the intensity of preparative regimen, prior donor transfusion, or disease stage. The pathophysiology of GVHD, the afferent phase. The recipient T cells activate donor T cells, antigen presentation occurs, and the T cell activation, and then the proliferation and differentiation of T cells. The afferent phase includes the attack of donor cells on host target T cells. The activated T cells secrete cytokine, and the secondary effect cells damage T cells. GVHD could be divided into acute GVHD and chronic GVHD according to the duration of GVHD. If the GVHD occurred within 100 days post-transplantation, it is called acute GVHD. If GVHD occurred or lasted after 100 days post-transplantation, it is called chronic GVHD. The acute GVHD often involves the skin, liver, and gut. The chronic GVHD usually involves skin, mucous membranes, gut, liver, and scleroderma. Acute GVHD occurs in about 25 to 70% of all stem cell transplantation patients. The grading of acute GVHD was based on a combination of severity of presentation, the survival based on the grade ranging from 0 to 90%, the death usually due to infection, hemorrhage, or organ failure. Stage of GVHD by organ system. According to the involvement of skin, liver, and gut, the GVHD was graded. The skin manifestations include rash and erythroderma. The liver involvement includes elevated bilirubin. The manifestation of gut includes diarrhea. Overall grading of GVHD. Acute GVHD was divided into grade 1, 2, 3, 4 according to the involvement of skin, liver, gut, and ECOG performance of patients. This is acute GVHD involvement of skin. There is swelling, generalized erythroderma, and bullous formation. This is the lichenoid lesions of chronic GVHD. This is the skin of GVHD, the GVHD skin. Acute GVHD prevention includes cyclosporin, tacrolimus, methylprednisolone, methotrexate, cyclophosphamide, and anti-thymocyte globulin. Chronic GVHD. The incidence of chronic GVHD accounts for about 15 to 60%. If the patient had acute GVHD, there is increased risk of chronic GVHD. Chronic GVHD often involves the skin, mucosal changes, esophageal strictures, liver disease, and thrombocytopenia. The long-term complications include the infection risk prolonged with GVHD. The incidence of infertility was higher in women than in men. Hypothyroid accounts for 15 to 25%, especially during TBI. Cataract during TBI or steroid administration. A vascular necrosis born due to the use of steroids. Autoimmune dysfunction, the dry mouth due to GVHD or TBI. The malignancy increased. The treatment of chronic GVHD include prednisone, cyclosporin, supportive care, and other drugs such as thalidomide, mycophenolate mofetil. The post-monitoring of the engraftment. The chimerism test was performed by the analysis of genomic polymorphisms, that is short tandem repeat, in short name STR. The STR test is done in 1, 2, 3, and 6 months and 1 year post-transplantation. The factors influencing the outcome of stem cell transplantation include the disease factors, especially the stage of the disease, the patient-related factors, including the age of the patient, the donor factors, including HLA mismatch, the sex of the patient, the viral status, especially CMV positivity, the peritransplant factors, including the preconditioning regimen, GVHD presentation, stem cell source and content, and the post-transplant factors, especially GVHD. The summary: stem cell transplantation is a unique effective treatment modality, providing normal stem cell production for many malignancies and genetic disorders. The HLA matching is critical in all allogeneic transplantation. The HLA allele matching is associated with lower risk of graft failure, GVHD, and transplant-related mortality. It's the end of this class. Thank you very much.